A report indicates that how migrant care workers are exploited in UK. Christina McAnear, Unison's General Secretary, said, "Care staff who come here from overseas are shoring up a crumbling sector. And these workers should be treated with respect, not taken advantage of and abused. No one deserves to be treated in this despicable way." The government must overhaul the sponsorship system as a matter of urgency. This would help prevent exploitation and drive up standards across the care sector. Responding to the findings, Dr. Shabna Begum, Chief Executive of the Runnymede Trust, said, "The racist treatment of migrant care workers, who are disproportionately people of colour, is symptomatic of the dreadful state of our broken care system. Chronic underinvestment in the care sector has created a situation where the people who we rely on to care for our elderly and vulnerable are exploited and brutalized on Dickensian terms by both the system of recruitment and then the conditions in which they are expected to work." Jamila Duncan Bozu, a solicitor at the Anti-Trafficking and Labour Exploitation Unit, a charity providing specialist legal support to survivors of trafficking and slavery, said, "Exploitation is baked into the systems which the UK uses to recruit migrant workers. Workers who are tied to an employer and reliant on them for their ongoing visa status are far less able to escape exploitation. The current system is a gift to those who seek to exploit migrant workers, as they can be certain that there will be little oversight or scrutiny of their actions." A government spokesperson said, "We are deeply concerned about findings from this report and stand firm on our zero-tolerance approach to labour exploitation and abuse of our immigration system by unscrupulous employers. That's why we have already set out first steps to ban rogue employers from sponsoring overseas workers and will deliver legislation for the Fair Work Agency to ensure strong and fair employment rights for all. Businesses found guilty of breaching employment law will have their sponsorship licenses refused or revoked, and care workers affected by this will be supported to find alternative employment."